Hi, it's Sony Singh, and I'm coming to you from Iceland from the AAGL World Summit on Endometriosis. I'm here with yet another expert, Dr. Ted Lee. Ted, tell us about yourself.
Well, thank you for this introduction. I'm based in Pittsburgh, Pennsylvania at the University of Pittsburgh Medical Center. I'm in the position of training many gynecologic surgeons over the last 17 years.
That's fantastic. So you're not only a fantastic surgeon, but you're also a teacher. And so one of the questions that comes up, because you presented on some amazing surgical techniques, is do others, insurance companies or governments, depending on the healthcare system, recognize that endometriosis is a complex surgical condition?
The answer is no. Unfortunately, the endometriosis is such a complex disease. We have probably 30 diagnoses of endometriosis on various sites of the body. Yet we only have one single surgical code for endometriosis, and that can range from burning endometriosis for a few seconds versus extensive excision endometriosis that will take 5-6 hours, involving over the ureter, over the rectum, behind the uterus, between the rectum and the vagina, and so on.
So the bottom line is that surgery can take hours, and yet it isn't being recognized. The same for Canada, and you'd say it's the same in the U.S.
Yes,
as well.
yeah. And so I think it's important, I'm in a position of training the future generation of gynecologic surgeon. And, I think this is not just about the numerical reimbursement for the procedure. I think it's about being valued for the work you do. So if for example, I work in the hospital, I'm employed. So my employer needs to value the work that I do. So I think it's very, very important to be able to justify the time you spend treating the patients. And ultimately, we want to have the future generation of gynecologic surgeons willing to value their work.
Yeah, that's great. So if you want to watch more, we're going to go Facebook Live in a couple of minutes, and we can talk then. Thanks.